Welcome, everyone. How are you doing today? I'd love to see where you're joining me from in the world. Drop it in the chat box. Happy morning, good evening, wherever you're coming from. I would love to hear where you're joining us in the world and what are you bringing with you? Are you bringing some pen, papers, your computer? Definitely drop it in that chat box. I want to see. And what I'm going to do is while we're giving everyone a minute to come in, we've got an amazing group of pet parents joining us. And I love seeing it. Hi, Jennifer, Douglas, Georgia. I'm going to go ahead and share this as more and more pet parents join us this evening for our webinar. All right. Oh, I'm seeing Diane from Canada, Sherry from Alberta, Jennifer from Canada. We've got a lot of Vancouver, Canada. I love it. We've got a lot of Canadians here. Audi from Oregon, Kathy from Georgia. Awesome. We got all over Toronto, Canada. This is great. All right, let me share this with everyone and we will get started. Rachel from Florida. We got, wow, it's just going crazy. I love it. We got people from all over Ventura, California, Michelle. All right. Okay, let's get that going and let's get my screen back to where it needs to be and we will get started. Okay. All right, perfect. Love this. So Bruce from Arkansas, Michelle from sunny Florida. Yay, Colorado super sunny today. Also love it. I love seeing everyone showing up. Wow, we've got people from Peru. Wow, this is amazing. Massachusetts, Indiana, Nita from Washington, Barb from Arizona, Julie from Texas, Janelle from Florida, Suki from Omaha. Hi, Suki, welcome back. Awesome. Sandy from Canada. Chris, Fort Collins, you're just down the road from me probably. That's wonderful. I love it. Such a small world. Bev from Canada, Pa from Illinois. Wonderful. We have an amazing group of pet parents here tonight joining us. Sunshine Coast, we've got Australia in the house. Wonder if there's any New Zealanders here, because you hear my story. I went to vet school in New Zealand. So Nicole from Ontario, Canada. This is great. We've got people from everyone. I see Bethany. Hi, Bethany. I'm so glad you could join us. Kathleen from Colorado. I love it. I love it, love it, love it. This is fantastic. I am so excited to share this information with all of you tonight and to give you some tips and some tools, some easy things that you can start with your entire fur family, your dogs and your cats to get them going. Jess from Brooklyn, New York. Welcome, Robin, Canada, Megan, Prescott, Arizona. This is great. So I want to make sure you guys grab a piece of paper, grab some pen, like a pen, grab a computer, grab a laptop, whatever you got near you, grab something to take notes on. Also, as we go through this presentation, there are going to be the opportunity to ask some questions at the end. So write down your questions. You can always drop them in the Q&A box as we're going along, and we'll go through those at the end of the presentation. So make sure you have something to take some notes on. All right, Kim from Minnesota, Jan from California, Susan from Canada. I love this. All right. So, all right, I appreciate each and every single one of you for showing up, taking the time out of your day to join me. So if you can see my video, I'm going to stop that. And what I'm going to do is we're going to go through this. And like I said, at the end, we're going to do a Q&A and get your questions answered and get you on the right path to optimizing your dogs and your cats' entire health. So what we're going to be talking about tonight is the healthy, holistic pet for life. What I'm going to go through are these 5 key pillars that are going to help your pets live a longer and healthier life. So let's get started. First off, if you have a phone near you, I want you to put it on airplane mode. I want you to turn off all those distractions because I want you to stay super focused during this entire presentation. And now there's a strategy that we follow that we're going to go through during this presentation. We're going to talk about how you should be feeding your pets the best quality food. You're going to learn how to feed the best types of food to support aging, provide longevity, how to balance the immune system by reducing toxins and stressors that can lead to chronic inflammation. We're going to talk about how to create a safe environment and learn what may be actually lurking in the environment and when to detox your pets. We're also going to be looking at balancing emotional health. So how to create a peaceful environment that supports overall healthy emotional health. And then we're going to be talking about how to achieve optimal physical health. So to ensure that the physical body and the mind and that connection are functioning at optimal levels. Now, you may be asking, why is this information important? Now, unfortunately, I'm here to tell you that everything you've been told may be wrong. We know that 1 in 2 dogs and 1 in 3 cats will develop cancer at some point in their life. Maybe you've had a pet with cancer or chronic illness, and you want to learn everything possible to prevent it from happening again. And I'm here to tell you that genes account for less than 10% of disease that occurs in our pets. But the good thing is the rest is up to you. Now, the other part is that your pets are exposed to over 85,000 toxins per year. These 3 pictures are my beautiful fur babies, my Finn, my German Shepherd, my 2 cats. They taught me a lot about what I'm going to teach you today. And I lost them, unfortunately, all too soon, all 3 to cancer. But don't worry, there's a lot of stuff that you can do to help prevent this from happening in your own pets. Now, here's the thing. Most pet parents, most are stuck in this vicious cycle of the same health problems, giving a drug, expecting the problem to be fixed, but their pets only feel better for days or maybe months, but the same issue keeps coming back. Do you find yourself in that situation right now with your pets? But on the other hand, when we take a holistic health approach, so holistic pet parents, only holistic pet parents can feel confident that the root cause is being addressed to clear the problem, achieve optimal health, and they have the tools to balance and maintain a healthy state without relying on numerous vet visits for the same problem. So we have to look at the bigger picture. What does holistic mean? It doesn't mean that we don't use conventional medicine ever again. There's a time and a place. But when we look at the true definition of holistic, we're looking at the treatment of the entire pet. So this takes into account the emotional, the environmental, the nutritional, and the physical health factors, rather than just treating and looking at the symptoms of the disease. So essentially what we're doing is we're looking at the entire ecosystem of our pets, ourselves are part of the ecosystem, the environment, what we're surrounding ourselves by, the food that's going into them. So it's a much bigger picture rather than just focusing on symptoms and staying stuck on that vicious treadmill that just keeps you going to the vet clinic over and over again for the same problem. So I want you to settle in and stick around if you're ready for a change in your pet's care. You know there's a better way to achieve optimal health, but maybe you're overwhelmed by where to start. You might feel frustrated and tired of all those vet visits and bills that don't give you progress. And you want to know that you're doing everything possible to help your pet live a long and vibrant life. And you want a supportive community to help guide you on the right path. And maybe you're curious about different ways that you can achieve health in your fur family. Now, here's the thing. This is the time that you can leave this masterclass if you want quick fixes, you don't care about finding the root cause, you don't have time to take action, you think you may already know everything about pet medicine, you may think kibble diets are truly the best food for your pet, you only believe there's one way to look at health. And here's the thing. You may get mad when I give you 45 minutes of strategy that's helped hundreds of pets and then complain when I make you an offer for an exclusive opportunity to work with me. Because at the end, I will be inviting you to apply for our Healthy Holistic Pet for Life Blueprint program. So at the end of this call. So be aware of that, get prepped for it since I'm so excited and I want to see if you're a good fit, since my sole mission on this planet is to make sure you have the tools and the tactics and the support to help your fur family live their longest, healthiest, and happiest lives possible. So Who is ready to dive in? I want to see like hands go up, chat, like let's go, right? Who is ready? Remember, stay until the end. We're going to do the Q&A. I'll pop back on the camera at the end, and I'm loving the excitement here. You guys, you are my people. So let's get going, right? But first, once again, I want you guys to like raise the roof. Give me those thumbs up again in the chat box. And I am just so excited. I love talking about holistic health. So let's get going. But I want to jump into a little bit about me and what qualifies me to help you. So I started my veterinary career as a young, naive veterinarian in New Zealand. I thought using the big brand kibble foods was the best for my pets, making sure I did all the vaccines, the dewormers when I thought I was supposed to, that I learned about in vet school. Here's the thing. I thought I was doing everything right. And then my husband developed an autoimmune disorder at the start of 2014, and it completely changed how we looked at medicine. I started learning more about an entirely different world of medicine that focused on the root cause versus symptomatic care. And I quickly realized that I could be doing so much better for my patients. So I did all the things. I became acupuncture certified. But here's the thing, I quickly came up against other vets in my practice, not liking the type of medicine I practiced because they didn't believe in holistic medicine. You may be experiencing that right now too with your own vets. I learned everything that I could about holistic medicine and became certified in Chinese herbal medicine, continued to learn more about pet nutrition, and clients were actually driving hours for help with their pets because nothing else was working for them. Who here feels like that? However, I was still coming up against vets that didn't believe in this path of healing. I was seeing amazing results. I loved this new path I was on. So I created my own business focusing solely on holistic medicine. The natural pet doctor was growing, but then something happened that completely rocked my world. My soul pup, Finn, he started having seizures and we diagnosed a brain tumor. And so we changed Finn. He was changed to a home cooked diet years prior. We put him on herbs to help him too. We even avoided 2 knee surgeries prior to this. And he was a 70-pound German Shepherd. But here's the worst part with the brain tumor and the seizures. He did not do well with the conventional medications to help the brain swelling and the seizures. We were actually told by the specialist there was nothing else to try, and he probably had a week left. So maybe you've been there too, hearing there's nothing else you can do, being told that raw food is going to kill your pet. Maybe you've been laughed at by the veterinarian or had eyes rolled at you. Or maybe you've even stayed up for hours on end, researching, trying to find the answer to help your pet feel better. But there was something else I could do for my Finn, and that was holistic medicine. We were able to give him another amazing year of life with great quality of life. No one knew he had a brain tumor when there was literally nothing left on the conventional side. So Finn helped me realize even more that pet parents are being told every day there's nothing else you can do, or to just wait and see when there's another world of medicine they can use. So here's the best part. I realized I could help more pet parents by teaching pet parents online how I helped Finn when he was given a week to live. My husband's life has changed with holistic medicine when we were told there's nothing more he can do other than strong drugs for his autoimmune condition. But by realizing there's a blueprint for achieving optimal health, I turned my years of holistic pet experience into a program that breaks it down into easy to implement steps. The results are amazing and they help pets live longer and with more vibrant health. So once again, I want to hear, are you ready to learn more? We're getting there. We're getting there, I promise. So here's the thing. I love it. I see you guys. I see you raising your hands and raising the roof over there. So I started with the doubters, the naysayers, and the critics, but seeing the results with my own family, the furry ones and the non-furry ones with my husband and my patients, I became so determined to share these tactics that give pets health and pet parents hope again. And these tactics I'm about to share truly, truly changed my life and the way I practice. So here's just a few of the amazing results we've gotten for pets across the world. So finding Dr. Katie through a friend's referral was the best thing that could have happened for our Dane girl, Jazz. She suffers from lymphedema and has severe environmental allergies that even conventional medicine and allergy injections were having trouble managing. So enter holistic and natural approach of Dr. Woodley, and she's thriving today with no need of her allergy injections, very little use of conventional medications. She can be a dog and go outside again without being booted up. So thrilled. And another great one, I'm so happy to have found Dr. Katie. I spent countless dollars with regular vets regarding issues with my 16-year-old cat. Tests were showing nothing, told to just give him meds. They all chastised me for feeding him a raw diet, which I firmly believe in. Dr. Katie did the opposite. She also put him on some Chinese herbs and enzymes to address what are obviously GI issues. He began improving within just a couple of days. I highly recommend Dr. Katie for your holistic vet care. And here's just another one. So Dr. Katie's amazing. We have two little boys. This is Henry in this picture. Isn't he adorable? So Henry was diagnosed with a torn ACL approximately 4 months ago. We were told he needed surgery ASAP. We tried a more natural way instead of surgery, and boy, are we glad we did. We did a bunch of research on the internet for holistic vets, and when we came across Dr. Katie, the search was over. She was the one. So quick fast forward, Henry's now on herbal supplements, gets acupuncture, doing awesome, no surgeries. And did I mention Henry loves Dr. Katie, runs out to her car to greet her and follows her back to the car when she leaves. By the way, he is just adorable. And then we also have another one. Dr. Katie's amazing. I love giving the animals opportunity to be healthy the holistic way before the need to turn to Western medicine. Dr. Katie treats every one of her patients like her own pet, and the amazing support she gives the human patient is incredible too. Dr. Katie helped my 11-and-a-half-year-old Dane with arthritis, another one at 7 years old with a pulled muscle, 2 puppies, one with a chronic UTI, and one with immune issues. I'm happy to say the amount of improvement or the non-existence of issues through herbs, acupuncture, and diet has been achievable through Dr. Katie. And then the final one, could not be happier to find Dr. Katie. She's been a blessing to the health of my 2 dogs. I highly recommend her, extremely knowledgeable in food and supplements. So here's the thing, we've been able to help pets overcome allergies, liver disease, IBD, many other diseases, increase remission times with cancer, get off their prescription diets, prevent disease, feel their best, reduce vet bills, and help their pet parents feel empowered, confident, and supported with holistic pet care. So if you're ready to do the same, I want you to drop a ready in the chat. And so by having this blueprint at your fingertips, I want you to imagine right now, imagine where your pet's health could be in 1 year. Just think about that, envision it. What would it look like if your pets felt incredible in 1 year? So consider this your fast pass. All right, this is the pillars. These are the 5 pillars to achieving optimal health. Seems pretty simple, right? And it can be, but it can also feel very overwhelming if you're not sure where to turn. And these may be new concepts to you if your vet hasn't discussed these areas. So let's start by breaking it down into some simple steps. So step number 1, I want you to assess your pet's nutrition. So it's time to get more fresh food into your pet's diet. But first, why is nutrition so important? Now, I'm always talking about this. So if you've been following me, you've heard me say this before. Food is the foundation for health. But unfortunately, veterinarians receive very little nutritional education while at vet school. Because of this, most pets are put on kibble processed diets. I did that right out of vet school. I did what I was taught, unfortunately. And here's the thing, everything is tied to gut health. And the food going into your pets is not optimal. This can lead to disease, shorter lifespans, and more vet bills over the life of your pet. Now, keep in mind, our dogs and cats have 0 requirements for carbohydrates. So when you think about kibble diets, what is it made of? Mostly carbohydrates. It can be up to 50% carbohydrates. So here's the thing though, even just improving the diet with adding fresh food as a topper, this is just 3 times a week. You can reduce the risk of cancer up to 90%. Pretty powerful. Now, here's the thing. I want you to look at your pets and see, do they have some of these symptoms? And if they do, there might be some component where that gut health is off. And if there is, the food you're feeding your pets just got even more important. So some of the signs that we may see that can actually indicate an unhealthy gut are going to be weight loss, dull hair coat, autoimmune diseases, allergies, sensitive GI tract, dental disease, bad breath, even with clean teeth, inflammation, ear infections, anxiety, other behavior issues, and thyroid issues. What I want you to notice about this list is that some of them seem completely unrelated to the gut. And that's the problem. When we start treating symptoms, we completely miss the root cause. Now, here's the other thing, right? Something to think about. Veterinarians are the only medical profession that recommends a dry processed kibble diet for the life of your pet. Can you imagine if you took your newborn in and to the pediatrician, your newborn human baby, and they said, you know, here's this bag of Cheerios. You can just keep them on Cheerios for the rest of their life. It's very similar to what we're recommending for our pets for every single meal. And it doesn't mean that we can't never feed kibble ever again, but let's talk about what you can do as a pet parent to start optimizing gut health. Here's the thing, if this feels overwhelming, start small. 10% food toppers, this is where we can use amazing superfoods like blueberries, broccoli sprouts, even sardines or eggs. Now, we also want to be looking at removing inflammatory ingredients. So reading those ingredient lists and looking for things if you're feeding canned food like carrageenan, making sure we're avoiding GMO products, corn, soy, gluten as much as possible. But here's the thing, decide what type of food is ideal for you and your pets and your budget. And then what you want to do is transition to fresh food or add in fresh foods 3 times a week at least. Remember, we have those studies that show us that just adding in fresh food on top of a processed kibble diet 3 times a week reduces the risk of cancer by 90%. And when I say transition to fresh food, what I mean is getting off of like kibble diets. So if we can get to a dehydrated, or if we can get to a balanced homemade diet or a freeze-dried or a raw food diet, that's going to be much more healthier for your pets and support a healthier microbiome or gut health. Now, remember, most veterinarians are not taught about fresh food or raw food diets in veterinary school, so it scares them. They don't want something to happen to your pets, so they go with a safe option that we learn about. So keep that in mind too. Now, how do we support gut health? This is where I follow these principles of removing, replacing, rebalancing, repair. The 4 R's: remove inflammatory ingredients, remove overgrowth of bacteria, remove toxins, remove parasites, right? Anything that can create inflammation. Then we replace, so we're making sure we're getting good food, vitamins, minerals, rebalancing by probiotics, maybe we're using some digestive enzymes, and then we're repairing the inflamed gut lining. This is where a lot of pet parents will use things like slippery elm, L-glutamine. These are all great supplements that will help repair leaky gut or inflammation in the gut lining. Now, here's the thing. A lot of people don't realize there's a distinction here between feed grade pet foods and food grade pet foods. Food grade are human grade. So this is what we can eat. It's human edible. Food safety laws are required. You'll see on the bag or whatever you're looking at marked with human grade. It's much safer for you and your pets, of course. Now, feed grade pet foods, these are not human edible. These tend to be, they use 4D or disease meats, your diseased, dead, dying, disposed of carcasses. So there's things like cancer in the meats, like it's roadkill, not ideal foods that we should be feeding our pets. Keep in mind too, there's no safety laws required. There's no guarantee of the quality of the food. So for an example, I want you to look at this ingredient list and ask yourself, does this look like a high quality pet food you would want to feed to your pets? Like drop it in the chat. Yes, no, like maybe I don't know. Like it doesn't look like there's much like real food in it, right? And so when I look at this food, I put it in here because this bag of dry prescription food that's supposed to treat allergies is over $100 for a bag. So when I look at this, it makes me sad because, for one, vets just don't know we can do better. You can see that there's preservatives in here. There's partially hydrogenated canola oil, vegetable oil, cornstarch, hydrolyzed soy protein isolate, and the rest is synthetic vitamins and minerals. Not an ideal diet, right? Especially if we have skin disease, which most likely results from gut health issues. So this is the problem with a lot of the vet industry, is that we just aren't educated enough in the nutrition side. But the thing is you've got some tools here to help get you started, help supporting a healthy microbiome, remove these inflammatory ingredients, and just start learning more about what's in an ingredient list. Now, keep in mind, the food you eat can be either the safest and most powerful form of medicine or the slowest form of poison. This is the hardest part about having a conversation with someone who believes that the processed food diets are best for our dogs and cats, because we usually don't see the results of malnutrition, vitamin mineral deficiencies until potentially years down the road when the damage has been done and is a lot harder to reverse. Now, the next pillar I want you to look at is your pet's immune status. Is your pet's immune system strong, weak, or being overworked? And this might be an area you feel uncomfortable with. So what conversations are you having at the vets regarding vaccinations, right? Time for their vaccine, you got the vaccine card, they're due for their vaccines, right, is commonly what we see. So how do you approach that conversation? Are you asking for titers? Is your pet healthy enough to be vaccinated, or do they have underlying health concerns that make you weary about them getting vaccinated? Are you deworming your pets without checking a stool sample? Do they need antibiotics for an ailment, or are there other options? And the other thing too to look at that directly affects immune health is, are you using flea and tick or heartworm preventative conventional products? So are we assessing the risk-benefit ratio? So where do you start? It's a lot of things that can be affecting the immune health. For one, highly recommend checking out WSAVA vaccine guidelines, printing it out, taking a look at it. Within those guidelines, they say to do titers. So be proactive versus reactive to keeping your pets healthy, and be the advocate for your pets. Ask for those titers, bring the WSAVA vaccine guidelines that every single veterinarian should be following, and say no to unnecessary medications and vaccinations. Make sure we're checking a stool sample for parasites prior to deworming. And then use supplements like chlorella or spirulina or green supplements at the time of necessary vaccinations to support the body. There's numerous studies that show that these green supplements help improve immunoglobulins in the gut, which supports a healthy immune response if they do need a vaccine. And make sure you're looking into alternatives for insect repellents. Also ask your veterinarian about if you are in a heartworm at-risk area, do you need to give it every 30 days, or can you extend it out to every 45 days? Or can you take a break during the winter time, like we recommend or should be recommending here in Colorado? So how can you improve your pet's immune health? Once again, these pillars are all interconnected. So we can go back to gut health. We know that 80% of the immune system is within the gut. So if we're not feeding a species appropriate diet and we're feeding a processed diet that has a lot of inflammatory ingredients, it's going to directly affect your pet's immune system. We want to be avoiding toxins and allergens, which we're going to talk about in one of our other steps. We want to make sure we're reducing stress in the environment. So emotional health has a direct impact on the immune system. Once again, using those supplements to boost immune health, support a healthy immune response like spirulina. Also your essential fatty acids, so your omega-3s from things like fish oil or green lip mussel can make a huge difference. And the other thing is too, is we want to keep your pet at an ideal weight, which leads me into step number 3. We need to be assessing your pet's physical health. So when you look at your pet, would you say, are they in shape physically and mentally? Like, do they get a little bit squishy, or are they a nice lean body condition? Now I throw this in here because times have changed a little bit. Thank goodness we're a little further past this now, but it's something where physical health, emotional health is directly connected to physical health. If we're walking in a really stressful area, that's going to directly impact the health of your dog. So these are things to keep in mind as I discuss these different steps and pillars and how they might be overlapping with one another. Now, here's the problem with pets being overweight. 60% of cats and 56% of dogs in the US were obese in 2018. That was the last time a study was given out, a survey done to pet parents. So the numbers are actually probably higher, with a lot of pet parents staying at home because of the pandemic and maybe not moving as much and exercising as much. Now, here's the problem. Excess fat does not just sit there. It has severe consequences, and it actually has been shown for, if your pet is overweight, it takes away 2 years of life from your dog and your cat. That is a large amount of amazing memories you could have with your entire fur family. So we see reduced life expectancy, we can see skin disorders, orthopedic disease, cancer, metabolic and endocrine disorders, respiratory disorders, kidney dysfunction, chronic inflammation. So those adipose cells, so those fat cells, they're not just sitting there. If they are just sitting there, they're also putting extra weight on the joints, right? So older pets, it's going to be harder to move, but it's also releasing inflammatory cytokines into the body and increasing the amount of inflammation and pain and other problems in the body. Huge, huge, huge issues for our pets, especially with over half of our dogs and cats being overweight. So how do you know if your dog and your cat are overweight? This is something I recommend pet parents do at least once a week, because when you're going to have your hands on your pet. I pet my cats like all the time, multiple times a day. They're so soft and fluffy, right? I know you can all relate when I say that. And this is where, when you're feeling your pets and petting them, this is where we can be very cognizant of how they feel. This is where we can do body condition scoring. So when you run your hands along their sides, can you just feel their ribs? It shouldn't be super squishy. You shouldn't feel each rib very prominently. But when you get to the back end, when you look at them from the top down, is there a nice hourglass shape where it indents and then goes out at the hips? And then when you look at them from the side, do you see a nice tummy tuck? So ideally, you want your pet at a 5. So you can see those pictures there. So this is really important. Do not compare your dog to your neighbor's dog. Your neighbor's dog is probably overweight. So if we say, oh, well, at least Fluffy doesn't look as bad as, Charlie over there. Well, Charlie may be a 9 on the body condition score, and maybe Fluffy's a 7. So we need to start looking at feeling our pets consistently, and then body condition scoring them, and then adjusting exercise and food to help them. So this is a similar body condition score for our cats. Do the exact same. Cats, sometimes they'll get the excess weight down that abdominal fat pad is what it's called. That doesn't tend to go away when cats lose weight. So keep that in mind if you do have an overweight cat and they drop the weight, they still may have that abdominal kind of saggy skin. So that can be their like new normal. Now, what are some quick tips for more activity and getting lean? So get outside, enjoy the sunshine. Oh my goodness, we just bought harnesses for our kitties to get them outside more and, grounding themselves with the earth. It is so powerful. So it gives you good energy. You're connecting with the earth, Mother Nature. You're getting vitamin D from the sun. It is good for you and for your pets. Also getting cat towers to encourage play, setting aside time each day for play with dogs and cats. Cats tend to be left out of this and just like left to their own devices to sleep all day. So sometimes we have to set up like 15 minutes to make sure we're playing with our cats. A great time to play with cats is around meal times. So cats will actually have increased appetites typically after play, because think about it, it's like a prey drive, right? They play with like the mouse and it's kind of cruel, right? Whereas like, why don't you just eat it? They're playing. And so if we can use meal times as reward for play, that can help your picky cats. We also want to make sure we're measuring calories, feed less carbohydrates. So if we're feeding a processed food diet, The high carbs can actually lead to increased insulin resistance, makes it a lot harder to lose weight. It's going to affect the blood sugar levels. And this is where a species appropriate diet can make it so much easier for your dogs and your cats to stay at a lean body weight. We can use high quality treats. So this is where we're using single ingredient treats. Make sure you're taking away a little bit of the normal amount of calories being fed at each mealtime. And you can also use things like puzzle toys. So your West Paws, you can take food and freeze it in there, and then they can kind of engage with that. You're getting environmental enrichment. And then you can do snuffle mats. Those are great options too. And for your cats, you can put them in there's Doc Phoebe's little mice that you can hide around the house, and then that stimulates prey drive too. So it's encouraging mental activity. Also, we're engaging the mind, keeping the mind healthy, more movement, and we're supporting lean body conditions. So important for optimal health. Now, step 4, assess your pet's emotional health. So I want you to think, is your pet's anxiety maybe causing a health concern? This is the area that is the most missed amongst all my clients. And I find that it's one that inhibits healing from occurring. And so what are some of the common causes of stress in your pets? So exposure to novel items, so new things like people, pets, new environments. How does your cat respond when the doorbell rings? What does your dog do when a person or a new friend or someone comes to the house? Also, being separated from their human family members. I remember back in college, we had a husky. I had a husky growing up through high school. He was like my best friend, my running buddy. And when I would go to college, I didn't go to college in Colorado, and he saw the suitcase, he would stay behind our chair and like sulk for an entire week. It was so sad, super stressed, right? If I had known better, I would have supported him better. I just didn't know at that time. Also, negative training methods like punishment can increase stress for pets, especially if they're already fearful. Changes in environment, household rules, routines, loud noises like thunderstorms, fireworks, constant disruption when sleeping or eating. I know they're so cute, right? When they're sleeping, my cat's sleeping right next to me on her fluffy bed, and I just want to pet her, and she needs her sleep though. So we have to make sure like kids aren't engaging with animals while they're eating or sleeping, and that they're getting their rest and we're not stressing them out. Also, lack of outlets to exercise, herd, run, or retrieve. Like if you have a high energy breed, we had Finn, our German Shepherd. If we did not exercise him, the dog would go literally insane. And that's connected to, we have our emotional health and physical health, that connection there. Now, I put this last, and it tends to be one of the biggest issues is our stress. So I want you to tap into yourself. How do you feel right now? It's the end of the day for a lot of people, especially in the Northern Hemisphere. And a lot of times people are coming home super stressed, and we don't check the stress at the door. We walk into the house and our pets absorb it. If we haven't dealt with it, they go, Mom, Dad, I can feel your stress, and they just absorb your energy. They're very energetic. They're energetic beings. And so we have to start assessing, where are we at? What are our levels? And what is our self-care like? Very, very important. So if you have a pet where you're finding you're at a standstill, you're doing everything right, you're not making progress, this could be the missing piece that's holding you back. So what are some of the signs that your pets could be stressed? So your dogs, excessive vocalization, right? Barking, of course, excessive yawning. Do you have a dog that's always yawning and you're like, why are they so tired? They're actually probably stressed. So we have to start assessing what's going on in the environment and how do I change that and adjust it. If you have a dog that's constantly pacing, so this is where like zoo animals are a good example of this, right? The pacing back and forth by the fence, that is a sign of stress. Lethargy, decreased appetite, tail chasing, excessive grooming, aggression, changes in behavior. So when you look at these symptoms, and these can be signs of a lot of different health conditions too, stress may be the start of something. And if we can manage the stress and alleviate it, a lot of times that won't progress to other disease conditions. So this is where that emotional health is the root cause of potentially the problem that's going to manifest in that symptom you're seeing. Does that make sense? And then we look at cat stress. So avoidance, if you have a friendly cat and all of a sudden they're not hanging out with you, what's going on? Lack of or over grooming, decreased appetite, inappropriate urination, defecation, spraying. This is commonly missed as a sign of stress when they're marking or they're not using the litter box. Vocalization, pacing, aggression, redirected aggression are all signs of your cat being stressed. So what can you do to help a stressed pet? For one, number one, check yourself. How are your stress levels? Assess your stress levels. Start doing things like meditation and self-care. So important for us, especially in the crazy times that we live in. You also want to make sure that your pet has a safe zone. So this could be, where are they eating? Is it super busy? Can we move the food bowls, the water dish, the litter tray into more quiet areas, especially cats? Cats are very particular about their litter trays, and it's a very vulnerable moment for them. Being out in the open, they're constantly like looking around, oh my gosh, am I going to be attacked? So especially if you have a multi-cat household, you want to make sure that you have at least enough litter trays to cover each cat plus one. So if you have 2 cats, 3 litter trays, all in different areas, not lined up together, if you have the space for that. So that way your cat can choose where they want to go to the bathroom and feel safe doing it. Another one is being consistent with routines. When we fall out of our routines, this is where our pets feel the stress. Regular exercise and playtime. Who here feels stressed or you don't feel good when you're not moving and you're not doing stuff, you're not getting outside, you're not breathing in oxygen? And then we also want to avoid stressful situations. So what I mean by this is, if you have a dog that's leash reactive or is dog aggressive, it's not a good idea to take them to the dog park or walk in a highly concentrated area until you get those behaviors under control and train some of those behaviors or work with someone to get those behaviors under control. The other thing too is, once again, it goes back to diet and gut health. There's this amazing thing called the gut-brain axis. So if the microbiome, so the bacteria that are in the gut, the ecosystem, so trillions of bacteria, protozoa, fungi, that should all be working well together in this beautiful ecosystem of our guts. When that is off, it has a direct connection to the vagus nerve, to the brain, and it can actually carry inflammation to the brain. And this is why when I see anxious pets or behavior issues, my thought is not to drug them to calm them down. My thought is, what's going on in the gut? And that is the first place I go, because most of the time that is the root cause of the behavior issue. So by feeding an optimal diet with less processed foods, more fresh foods, that variety, we're using different types of proteins, making sure it's balanced. We're getting good vitamins and minerals into that mix. That's going to support a healthy ecosystem. That's going to have a more healthy connection between the gut and the brain. Now, the other thing is too, is if you are noticing stress, as you saw, those symptoms of stress can be related to other health conditions. So you do want to take them in to be examined. Maybe we're doing some blood work. We're making sure that there's not an underlying health condition that's causing that. The other big thing too is there pain that's causing the stress and causing the behavior change, commonly missed. So we don't want to miss those also. We want to make sure that we're supporting and treating the things that are affecting our pets. Now, some of this holistic remedies that you can use that are really helpful at supporting really strong and healthy emotional health are things like CBD. So this is the non-psychoactive component of the cannabis plant. So a lot of people are like, oh, is my pet going to get high? Nope, not with CBD. And the great thing about this is it works on the endocannabinoid system. That system is very important for homeostasis or balance in the body. So if your pet's off, if they're not making enough of those natural endocannabinoids in the body, these hormones, then we can actually use CBD as those phytocannabinoids. We're taking the plant and using it to bind to those receptors in that system to regain balance and homeostasis. We can also use calming sprays. So this is things like Feel, your DAP, composure. Those are great options that a lot of pets respond really well to. This is where we can use supplements that are calming, that are going to have things like valerian, that are going to have tryptophan and calming amino acids. They might have some milk proteins too. Colostrum is another one that can help. A lot of times I'm using essential oils. I won't go too deep into that because that's an entire webinar by itself. But one brand I highly recommend that is made specifically for pets is Animalio. So Animal EO by Dr. Melissa Shelton. So that can get you started. Using food as medicine, food therapy is very powerful. So if you are feeding a kibble diet, I would do your best to get your pet transitioned over to a fresh food diet, and working with a practitioner that uses food therapy to help create diets that are going to rebalance those imbalances. We can also use herbal medicine. There's a lot of different Chinese herbs. We can use adaptogens like ashwagandha to help calm down excess stress and rebalance. We can support adrenal glands. And then there's this beautiful thing called herb gardens that you can use too, especially with your cats. And Naturally Cats, they sell herb gardens, and you can get these from Dr. Judy Morgan's website. But these herb gardens are really powerful, where you essentially put down a towel, you put down dried organic herbs, and your cat will self-select them. Valerian is like the most popular one. Most cats will self-select valerian. Valerian is really helpful for calming inflammation, reducing anxiety. It's fantastic. It's the most amazing thing to watch your cat work around an herb garden and sit in it and just like choose these herbs. It's so powerful, and it's nice because you don't have to medicate them or put something in the food and hope they don't go off their food, that you're not supplementing something in their mouth and pilling them. So I highly recommend looking at herb gardens as an option, especially if you have cats and you want to support them in a natural way. And then the step 4, we're assessing your pet's environmental health. This is where we need to be looking at, is your pet's environment toxic? This can be a hard one because we don't see it. So just because we don't see it doesn't mean it's not there. And why is it so important? This is a huge one. It touches home. It hits me right in the heart for my own pets, because there's a lot of spraying that's done in the area that I live in and where we used to live. And this was an area that I did not optimize for my pets. And it is a huge area that I focus on now, because there's a lot of easy things that you can do to help get those toxins out or decrease the amount of toxins. And there's a lot of studies that show that herbicide treated lawns have been associated with a significantly higher bladder cancer risk in dogs. I've seen this with clients that live near golf courses, when I've seen bladder cancer rise. And I always ask, do you live near a golf course? And if they say yes, I'm like, dang it, it's the stupid herbicides and the chemicals that they use. So there's a lot of information out there, and there's a lot of studies. Also, glyphosate is common in processed food diets. So corn, your GMO products, glyphosate is Roundup. And HRI Labs, so Health Research Institute, is doing a lot of amazing studies that actually show that the levels of glyphosate is significantly higher, 15 times higher in dogs and 8 times higher in cats that are fed kibble diets compared to humans. Now, they found 0 glyphosate in dogs and cats that were fed raw food. And that's because there's less GMO products, there's not the carbohydrates in those foods. So something to think about. And then also your flea and tick preventatives. This is where assessing the risk to benefit ratio. Flea and tick products, though, I always recommend that pet parents try the more natural remedies. Now, insecticides kill, repellents repel, and natural products are repellents. So keep that in mind. You might have to apply it more frequently. It can take multiple remedies sometimes to make sure it's working. You might get a flea, you might have to pull off a tick, but this FDA alert with this newer class of drugs is scary. And I've had patients that have been given 1 dose of this drug, and they developed liver issues, behavior issues, seizure issues, neurological issues, and have even passed away. So Bravecto, your NexGard, your Simparica, your Credelio, I would be avoiding these and being really, really careful and using these products. And there's a lot of great natural remedies out there, a lot of holistic veterinarians. We have a resource in our YouTube channel and on our blog post at thenaturalpetdoctor.com. So definitely check those out, start getting some, start using them, see how they go. Another great option for your pets is just to put like a white t-shirt on your dog before you go out. If you're in a high tick area, it decreases the surface area of a tick attaching, and the white also makes it easier to see if there's a tick on them. So you can brush it away and kill it. And then also the other area that's commonly missed is the drinking water. And so think about it. Your pets are consuming water every single day. It's essential for life, right? And you can actually go to the Environmental Working Group website, so ewg.org, if you are in the United States, and you can type in your zip code, and you can actually see how many potential carcinogens are in your drinking water. So we had 6 the last time I checked that were exceeding the EWG guidelines. So this is why it's so important to filter our water. Now, this is a scary fact. We know that, and this number is actually growing, so this is an old number, that there's 85,000 toxins a year that you and your pets will be exposed to. That is a huge number, right? And this is why it's so important that we support these detoxification pathways. So the liver is one that's commonly focused on. It's not the only one, but this, I love this chart because it shows you that if your pet's deficient in a certain nutrient, the detox pathway may not be able to happen, where what will happen is if, say, we get to step 2 in the liver and we're missing our glutamine or glycine, we don't have enough taurine, or we don't have enough sulfur components, what can happen then is the body goes, can't process it, stores it in the fat. And then if you have everything, this is the power of really good quality food and using certain supplements and supporting the body with things like milk thistle and doing quarterly detoxes with your pets, then the body's able to convert those into a water-soluble toxin and remove it through the kidneys, through the urine, out through the GI tract, and get it out of the body rather than restoring it to have to be reprocessed. Now, some of the foods that you can use, I'm a huge fan of using real food to help our pets. It can be a little bit more difficult for cats, but we want to use high sulfur vegetables. So sulforaphane is a substance in cruciferous vegetables like broccoli, Brussels sprouts, and kale. And sulforaphane is really powerful because it has powerful anti-inflammatory and anti-cancer benefits. So it'll help reduce inflammation. It helps detoxify the liver. And then it's part of that phase 2 detox too that I just showed you in the chart with the liver. We can also use foods that are high in glutathione to support phase 1 detox pathways. So asparagus is very high in glutathione. And then of course, vitamin C is really important too as a really good antioxidant. So the great thing is with these, a lot of people get hung up on like the dosage. How much can I give? How do I know this isn't going to cause harm? What do I do if my dog or my cat won't eat these? You can blend them up. And this is also where you can use broccoli sprouts. So broccoli sprouts have almost 100 times more sulforaphane than broccoli itself. So you can just put a little bit of a pinch, blend it up or chop it up finely, mix it in with your cat's food. A lot of cats will actually eat broccoli sprouts, and you're getting that benefit. And you can even use half a cup of broccoli sprouts for a large breed or giant breed dog. Your asparagus, if you have a pet that has a sensitive GI tract, I do highly recommend slightly like steaming them to make it more easily digestible. But like I said, blend it up and then mix it all up with the food. And a lot of times pets will eat it that way. Now, keep in mind too, we have our indoor versus outdoor toxins. So some of the quick ways to clean up your environment. So once a week, this doesn't have to be a massive overhaul, which can be really stressful when you start learning about all these different things. But once a week, you can assess the products you use. And then as you use them up, you can change them out for cleaner products. The EWG website has an amazing resource for cleaner products and brands that you can check out. Also, we need to be aware of what we're using for artificial fragrances. I can't tell you the amount of times I've done a house call and I walk in and I'm like, you have a plug-in somewhere, which is great because it gives me a better idea. Like if we're seeing elevated liver values, I'm going to be asking these questions. If I'm in someone's home, I get a full picture of like, what are they using? What are the smells? I smell something artificial. So plugins, candles, poor quality essential oils, those are the things that cause harm. When we use high quality, non-adulterated or synthetic essential oils, those are safe for pets when they're dosed appropriately. The other thing you can do too is take your shoes off, because think about all the things outside we can't control. We're dragging them in on our shoes. So take your shoes off. The other thing too is wipe down your pet's paws and their body after walk. So using your unscented baby wipes, or you can just get a washcloth and wet it and wipe them down. You're removing pollens, you're removing toxins. You can also do detox baths with apple cider vinegar every quarter, brushing them. You're supporting the skin detox pathway. So we want to support these detoxification pathways, liver, skin, kidneys, gut, with your pets every day, or at least 1 week of the month. You're doing more potentially if you're in a more toxic area, or if they need anesthesia or some other like medicine, or each pet is an individual, but by doing just these basic things, you will improve their health dramatically. I promise you, it will make these small changes add up to a huge effect and results. So here's the thing to keep in mind. It can feel really overwhelming, right? But when you have a partner to help guide you along the path, a holistic life becomes a lot easier every step of the way. So with my own family, we took one step each day. We built that strong foundation following these 5 pillars of that healthy, holistic pet blueprint. So each day getting stronger and less sick. And this is how my clients heal their pets following this blueprint. So nutrition, immune health, physical health, emotional health, environmental health. And here's something to keep in mind. I started with holistic medicine because my husband was sick. I went down that rabbit hole, hours and hours, years of research, additional certifications and degrees. So you may already have a pet that's had cancer or another disease, and you vowed to yourself to do everything possible to not go down that path again. Or you want to do everything possible to keep your fur family healthy. I see you guys shouting it out. Yes, if we can prevent disease, that is a much better place to be in. So the small steps and support from people who have been there before are so much more important than all those naysayers and the people who don't believe in your journey towards holistic medicine for your pets. Your time is now. You need solutions now. So I want you to meet some of the adorable patients whose lives have changed through holistic medicine. This is Butters, and Butters is just a really sweet cat, adorable. And Butters came to me with GI issues, allergies, and a mast cell tumor on his eyelid that couldn't be surgically removed. And he was on steroids. Oh, he also had kidney disease too. So this poor kitty is dealing with all sorts of stuff. His mom knew, like, we've got to get him off steroids. I need to support gut health. I don't know how to do this. He's on a prescription food. I need to transition. She knew she needed to start somewhere. We were able to get Butters onto a balanced homemade diet, supplements, support the immune health, support the gut health. And here's the thing, the mast cell tumor did not flare up again. He didn't scratch his eye raw. His kidney values went down, which was amazing. And he felt really good. And fast forward, he actually developed a squamous cell carcinoma in his mouth. So I think it was about a year later after we started seeing him, he developed a cancer in his mouth. And squamous cell carcinomas are really, really bad. Usually it's like you've got short period of time, month at most. And they removed it and they said, this isn't good. They did a biopsy, confirmed it, and said, kind of just get ready. Like, this isn't good. Went to an oncologist, like got all the opinions. And by tweaking herbal medicine and adjusting some stuff, Butters is still here. So knock on wood, Butters is doing really, really well. And we're literally 6 months out from that diagnosis. That is the power of using a holistic approach and making sure we're supporting those 5 pillars. And then we have Piper and Cub. They had chronic GI issues, crazy anxiety, allergy issues galore. They were both rescue dogs from puppy mill situations. Poor Cub was in a cage and bred like nonstop when his amazing pet parent adopted him and rescued him. And through the power of food, through the power of looking at emotional health, looking at environment, using supportive supplements, and getting them back on the path, they've done really, really well. And then there's my Finn. He's my guiding light. He's the one I always go back to. There's so many things I would have changed getting him as an 8-week-old puppy in vet school, but now we know better. And with my patients and with my current pets, things are much different, because when you know better, you can do better. So this is not just theory. So until now, I've only been sharing the system with my one-on-one clients, like for Butters, Piper, Cub, Finn, and so many more pets. So I've tested this entire system. I've proven its results with my own pets and clients. And at this point, I know I can make a greater impact by sharing it with more people, which is why I'm here today. This method is time-tested and proven. Yes, holistic medicine can work to achieve optimal pet health. I'm using these strategies for this webinar you're on right now, plus many others to help pets feel their best. So if you're thinking, I'm ready, where do I start? All you have to do is commit, focus, and take action, which you've already done by taking the time to be in this masterclass today, which I totally applaud each and every single one of you for taking time to learn more on how to show up and do better for your pets and your entire fur family. So I just gave you a brief glimpse at the Healthy Holistic Pet Blueprint, but as I'm sure you can imagine, this is just the tip of the iceberg when it comes to achieving optimal pet health, healing the body, preventing disease through our entire 5-pillar framework. So do you want to feel like this lady? Like, you can just figure it out yourself, continue on that vicious treadmill, or you can get the proven success path. Feel supported, feel comfortable, know that you're heading in the right direction. So if you're smart and you decide to work with me, nothing is held back, no missing steps. You just need to follow my lead step by step. I'm on a crazy mission to accelerate your holistic knowledge, to remove the headaches and bad advice I was given throughout my entire veterinary career, and give you the exact process to follow to truly build optimal health and wellness for your dogs and cats. And that's what our Healthy Holistic Pet for Life Blueprint includes. So I've taken this entire process from start to finish in creating optimal pet health through those 5 foundations for all life stages for dogs and cats, how to use nutrition and navigate this confusing area, detailing what your pet needs to keep them safe and healthy in their environment while protecting gut and immune health, how to help your pet's emotional health, and reset your pets through nutrition, environment, and supplements, which will reduce your vet bills and stress, and put it all into this program with the support you need from a safe community and a holistic vet that's doing this every day. And I'm giving you access for life. Why? The biggest issues I see with the online pet health space is there's so much information out there, each of them trying to teach an aspect of this intricate puzzle of holistic pet care. So maybe there's a Facebook group why you shouldn't use conventional meds isn't helpful if you don't know how to safely and effectively use holistic medicine. A course on first aid doesn't give you long-term health if the foundations aren't there. Your veterinarian telling you raw food is toxic is confusing if you don't have the tools and studies to share with them to have an open conversation. I wanted you to have the best possible launch pad for a healthy, long life for your entire fur family, because I've been through it. I'm coming at it with years of experience, experimenting and finding the things that actually work long-term versus just trends. Now, Marissa was one of my many amazing clients, and she literally said life-changing health in just a few weeks. She was frustrated with conventional options for her dog's bladder stones. She went through an expensive bladder surgery and was told to feed a prescription food for life. Now, within weeks of following our blueprint, those principles we just went through, Oreo's feeling better than ever on a fresh food diet and supplements. And here's some other testimonials from the program. Barbara said, Dr. Katie Woodley, you're amazing. Just had an appointment with Dr. Kangas. And she said the supplements you recommended based on Kai's hair tissue results and medical history are spot on. She also said that Kai has come a long way in the past few months. His diet's well balanced. The adjustments needed are minor. He is doing so much better. We also, Madison, my favorite so far is Dr. Katie is always there to answer your questions, and the community is also there to help you out. For so long, I've been trying to help 3 of my cats' guts and get them strong enough to be able to try wet food. I appreciated so much that Dr. Katie told me what to start out with, especially since after the gut seminar, I was overwhelmed and thinking I would never be able to help them. Now my babies are on the right track. And then Bethany, the biggest positive impact that I've noticed right now is my new confidence and knowing that what I'm giving him is right for him. I do not feel like I'm guessing. I have new hope and definitely feel that I'm doing something different to help Sparty. I've seen a positive change in Spartacus. And then Britt, I highly recommend the natural pet doctor, Dr. Woodley, for your holistic veterinary needs. Dr. Woodley's extremely knowledgeable, compassionate, supportive as we navigate how to best help our pets thrive. Her Healthy Holistic Pet program is incredibly helpful for those of us that don't know where to start, but want to learn more and do so with a supportive community. The final one, Tammy, although this was at the start, it was just an introduction. What Dr. Katie Woodley went through on the topics for the program is exactly what I've been seeking. It's been such an emotional roller coaster on finding the information based on science on the care I should be providing. Be a lot of information to take in, but I feel like it'll be well laid out. The community site's easy to navigate, so I can go back and reference if I need a refresher or clarification. I've been feeling drained and isolated on some issues my dog Yumi has been having, along with some bad experiences with aggressive vet visits with an expensive bill attached has been getting me down, but I feel much more optimistic. Big win for me today. So those are just a few of the testimonials from our amazing community that's already going through this program. Now, who's my dream pet parent? My dream pet parent is someone who wants to do everything possible to achieve optimal health. They love learning. They're not afraid to ask questions. And of course, they're kind to others. They love being a part of a community, and their fur family's health is important as their own. They want all the options, and they're not afraid to try things that are a little uncomfortable. So I'm going to ask you, are you next? And the better the fit, the better the results. So I'm building a legacy business to make sure we help empower pet parents all over the world. I don't just want any pet parent. I want the right pet parents in this community. So do you want in? And here's how the process works. So who is this for? You may be wondering, like, is this for me? Pet parents, pet store owners, trainers, people who educate pet parents. Even if there's veterinarians here, congratulations. I'm so glad you're here. And vet staff who want to learn more about holistic medicine. The pet parents who want lifelong health for their fur family and not just quick fixes. So understand that investing in your growth and education and having skin in the game is the only way to truly grow and not stay stuck on the treadmill. And people who are action takers and are actually going to implement the information. So if this sounds like you, you're invited to set up an interview with me to see if our Healthy Holistic Pet for Life Blueprint program is the right fit for you. So I personally set aside time in the next 10 days to talk to you and see if we can help. The call is approximately 45 minutes, and the intention is to understand your holistic pet care frustrations, your goals, and identify how and if we are fit to work together inside of our Healthy Holistic Pet for Life Blueprint program. Remember, this is a lifetime access program. So here's the link. You're also going to get an email with this link to schedule a call now. There's a lot of people in this masterclass and who signed up, and our schedule can only handle a limited number of calls, and we have limited number of spots. So just make sure you get in now to schedule that call, hear more about it, see what it's all about, and see if it's a great fit for you. And I want you to remember as you go through this process, your pet's health is an investment, not an expense. If I could go back and change all the things I did with Finn when he was a young pup through almost to his middle ages, I would do it in a heartbeat, because I know it would have made a huge difference. The things we changed made a huge difference. I know that. He probably would have developed cancer sooner. But this is where being able to empower yourself with the tools and knowledge to get started today will make a huge difference to the future of your pet. And here's what I know to be true. I would not be where I am today without investing and working with the people who were where I wanted to be. So once again, where do you want to be in 1 year with your fur family's health? So I'm going to invite each and every single one of you, schedule a call. You can go to that link, check your emails too. There'll be an email going out either now or within the next hour. So definitely check that. But now what we're going to do is we're going to take your questions. So I'm going to open up the floor for some Q&A. So drop it in the Q&A box. I'm going to end the slideshow. So I'm going to give you a minute if you want to write down that link, or like I said, you can go to your inbox and schedule a call now. And here we go. Let me stop my share and restart my camera. And here I am. Well, all right, everyone. Okay, let me end the slideshow and I can see your questions. And let's see. Okay, let me close this. Okay, let's see. How much is it to schedule a 45-minute call? So Tyler, so this is to learn about the program. So it's not a personalized consultation. So that's a great question. There is no call. This is something that I want to make sure you're a good fit for our program. And I love and I'm super passionate about the results we're getting. So this is to learn more about the Lifetime program, go through the entire blueprint program that covers those 5 pillars of health that we just briefly touched on. And then also there's weekly Q&As with me, support from the community, a separate community area for you to gain extra support from the other pet parents that are already a part of the program and myself. So it's here to really kind of remove, a lot of pet parents are spending hours and hours researching, feeling stuck. Something comes up with their pet's care and they're not sure what questions to ask or what tests to ask for. And that's the power of this program. I wanted to put it in one area where you feel supported and you can get answers to questions. And there's a lot of information in there that you probably never heard about. We've had quite a few pet parents that they've done additional testing for pets that had health conditions and uncovered the root cause was an endocrine immune imbalance, and they had no idea that could even be an issue. So that's the power of this. Let me help you make the process easier. So I hope that helps answer your question. Okay, so what I'm going to do, let me go through some of these. And okay, we'll start with, let's see, we'll start with Michelle. Let me see. So my 7-month-old Cavalier King Charles puppy had parvo when he was 3 months. Sister had it, she did not survive. He's had GI issues ever since. He was treated for parvo. I give him a soil-based probiotic Gastroelm with breakfast, dinner, or bedtime snack. He used to wake up at 3 a.m. with dry heaves, occasional vomiting during the day. My holistic vet gave him a homeopathy remedy with no help. Any suggestions, please? Anytime your pet has a GI issue, this is where we need to check the microbiome, because we can give all the supplements, but if we don't have an understanding of how severe the leaky gut is, the level of dysbiosis, it can be really hard to treat the root cause. So there's a great test that pet parents can order. It's called Animal Biome, and you send a stool sample in, they give you the results, and then they have the option of being able to do a fecal transplant. So they have capsules that it's a fecal transplant. So essentially what it's doing is it's reseeding, replenishing, repairing that ecosystem that I talked about when I was talking about gut health. So that would be number one, is starting there. The other thing too, I find, because parvovirus it wrecks the gut. So there's probably some level of dysbiosis. And so that means the bad bacterial populations outnumber the good. So doing that test, get an idea of what you're starting with, use the fecal transplant capsules. But a lot of times these dogs too have been on antacids, especially for the heaves and things like that. So we call it bilious vomiting, where if you haven't fed your pet within, like, if you wait like an hour in the morning and they vomit up bile, that's bilious vomiting. And that can actually be a sign that they don't have enough stomach acid in their stomach. And unfortunately, the treatment that a lot of vets will do is they will put them on antacids, which actually makes the problem worse. And it creates more severe dysbiosis. It can also, the Helicobacter organisms can overgrow and cause more health issues. So once again, I always go back to those pillars. I'd be looking at what's the microbiome look like and just start with those tests to get an overall idea. And then that way, you might find fecal transplant is all you need to do, because that works really, really well for a lot of pets. All right. Let's see. Okay. So Mary Ann, My viewer terriers are so finicky that they won't eat a raw diet. They like freeze-dried raw sometimes, but I can't get them to eat. If I try to do raw, they just won't eat it. So we let them free eat kibble, which they will eat. Great question. This is a common problem with cats too. So when this happens, so not every pet does well on raw. So I always talk about that because I think we tend to get stuck in this, like every pet has to be on raw, and that's not the case. And raw is a really cooling, energetic food. We talk about food therapy, and there's a webinar in the program about food therapy, the energetics of food, the different classes of foods, and how to assess your pet. Because food therapy is very, very powerful. So a pet that tends to, like a cat, let's take an older cat that is kind of creaky, you know, sits on the heater vent and is cold all the time, or pets that burrow under blankets and they get cold really easily. So this could be like your Chihuahuas, your smaller breed dogs, that tends to happen. Those dogs are cooler. And if we're introducing cooling proteins, cooler energy foods, it can cause an issue where they're like, I don't want to eat that food. It doesn't feel good when I eat that. So this is where we can balance that with more warming proteins, if that's the case, use those food therapy principles. But I would stick with freeze-dried raw if you can, Marianne, because your kibble, as I mentioned just briefly, we go into the entire pet food industry and how pet food is made, which is really eye-opening. We weren't taught that in vet school, and the whole rendering process and the sourcing and all of that is covered in the program. And if you can feed freeze-dried raw, it's less processed, it'll be better quality ingredients than a kibble. So I also, the other thing is too, is having free feed, like allowing them to free feed. You don't want that because they just know, like, this is a cat problem too, where you have to set up meal times to start transitioning them over, and then have perseverance and persistence and just patience. My friends, the two crazy cat ladies, Jay and Adrian, they call it the 3 Ps, and it applies to dogs and cats when we're transitioning over food. So I would definitely get those pets into a mealtime routine and take away any free fed kibble, and that can help the transition. And if they still don't do well with raw food diets, then what you can do is you can keep them on a freeze dried, and then just take a look at like food therapy principles, maybe start with that. Also support gut health. If they have dysbiosis, do an animal biome test, where you can add in things like digestive enzymes too, to help them break down the food. And Marianne, this is exactly why, like, Marianne doesn't have access to holistic veterinary. Who else doesn't have access to a holistic vet? Like, there's not that many of us. I mean, there's more, but see, I see a lot of people raising their hands that are still here. And this is why I created this program and the support, because there's too many pet parents that are left trying to navigate this space, and you're spending hours, and then you're like, is this going to cause harm to my pets? And then there's like more stress and worry. And as we talked about, like, the emotional health pillar is such a foundational unit for overall health. And so this is why having the support of the community, watching the pet parents in the community for this program has been amazing. How they support one another, cheer each other on. We share our wins, and they go through the program, and they can help guide new people coming in too, that, you know, are just getting started with this information. So it's very, very powerful. Okay, let's go through. Let's see. Donna, this is a more, so what would you recommend for dogs with Cushing's? So Cushing's disease is common in dogs. It's too much cortisol being produced by either an adrenal gland tumor or a pituitary gland tumor, and commonly pituitary gland. It's like a benign tumor, except for it's affecting the hormones and the feedback. And then what happens is there's just too much cortisol, too much stress hormone. So we see like all the side effects that we would see if we were to give prednisone. And what it comes down to, so whenever we see, this is something I talk about in the program, is that there's a progression of disease. So we now have a disease that has a name, right? And there are probably symptoms, and maybe with Donna, or if you're here and you have, like, you're listening to this and you're like, I have a dog that has Cushing's. It can be really frustrating to diagnose Cushing's before they get to the stage where it's actually a condition now, and it shows up on like the ACTH stim test or a low dose dexamethasone suppression test. But a lot of times these dogs are being tested over and over again. Those tests are not cheap either. And it's super frustrating. Your dog has all the symptoms. They're drinking a ton, they're eating a lot, they're getting the pot belly, they're panting a lot, they're overheating. And the thing is that with that, if this, we can catch it sooner by optimizing those pillars and reducing inflammation. So when we're treating Cushing, so since Donna's dog already has Cushing's, there's a lot of natural things that you can do, flax seeds and melatonin. There's an entire protocol. So Donna, I would ask your vet to look up that protocol, because a lot of traditional vets are actually using those to help lower and help with the hormonal support and get it in better balance. It doesn't mean that you may not have to use conventional drugs, but this is where, if you're not getting anywhere, partnering with a holistic vet too, going through the program, optimizing gut health, make sure that there's not dysbiosis, making sure the immune system is in better balance, because those will help tremendously in keeping the amount of drugs and the progression of disease down. So that's really, really important. Let's see. Okay. Sandy, do fruits and veggies need to be finely ground for the dog to properly absorb their nutrients? This depends on each pet. So dogs produce a little bit of amylase, and to break down like the cellulose and the carbs and that surround the fruits and vegetables. So dogs are facultative carnivores. They can tolerate carbs much more better than cats, but they do better with a high protein diet. One of the books I highly, highly recommend for every single person here, if you have a dog, is the book by Dr. Connor Brady called Feeding Dogs. And it has a ton of research articles. It's a great gift to give to your veterinarian for them to read also. And so if you're seeing vegetables, so one of the common ones is your carrots, and it passes through completely, like, you see like whole carrots, like the chunks, and you're like, well, why am I feeding this? They're just pooping it out. So this is where I recommend like lightly cooking them. And then that'll help break down some of the cellulose, that plant wall, to make it easier to digest. And you can always blend it up. So you can either blend it or not, but if you're seeing like blueberries popping out the back end, like that's a waste, especially if you're using organic blueberries or organic foods, which I highly recommend if you can. So blending them, lightly cooking it will make it easier to digest. You can also use a digestive enzyme. I saw Tara just meant whole carrots, cranberries, blueberries to come back out whole. So this is where I'd be blending them. So it breaks it down so that your pets are getting those really good phytonutrients out of the food, rather than just like picking it up in the poop and being like, what the heck, that was a waste of money. All right. Okay, Jan, great question. Okay, so if my pup ever has to visit an emergency vet, they are not open to my raw, gently cooked diet, especially if it's tummy related. If a pup had to stay overnight, they will feed junk. Any thoughts? So this actually came up in our community Q&A the other week with the program. And there's one of the kitties had to be hospitalized for a health condition, and the cat was raw fed. And it was amazing. I loved it because we've been talking a lot. We talk a lot about how to have a conversation that keeps the conversation open with your veterinarian. And so this is where this amazing pet parenting program, she went to the vet and she said, I've talked to the vet. This is the diet that was recommended, is fully, completely balanced. It's, what's been helping my cat. And they actually allowed her to bring it in and they fed it. Now, a lot of ER clinics won't do that, but you can at least have that conversation and say, like, this is what they like. This is supporting them. It's been working. It's balanced. And, my other veterinarian knows that they're on this and approve of it. So that's a great way to approach it, rather than going like, you suck. Like, why? No, my animal has to, like, they need this. And those are stressful times, right? If you're leaving your pet in the ER, being able to have the tools and the support to get the guidance on what to say, so powerful, because you're already stressed. If you can come and have the guidance and support, say this, ask for this, or something's going on, like make sure they're testing for this. And that is the power of it too. So, if you can't get past that, then you just have to support their gut. I mean, we've had other members that their pets went to the ER. They didn't allow them to bring the raw food diet in. They fed the prescription food and the animal got diarrhea. So we have protocols in gut health, the gut health module on how to support your pets with diarrhea and other tools and options. And we were able to nurse like her other cat back to optimal health without using drugs like metronidazole, which was really powerful and something she was very grateful for, to be able to have that support and be able to ask those questions. So you can get through it. Sometimes it's not ideal, but that's where being able to, work on those foundations and have guidance can really help. Diane, does my dog need additional omega-3s if he takes CBD oil? That's a great question. They are not the same. So I use them together all the time. And also, is hemp seed alone considered omega-3? No. So this is where you're using CBD is working on, it's a phytocannabinoid. Your omega-3 essential fatty acids are an essential fatty acid. They're different. And your hemp seed can be a omega-6. So they're very different, but I would be using, so your omega-3s for anti-inflammatory support cell membranes, your CBD oil is going to support that endocannabinoid system. We use CBD oil for Finn. That was a big part of his protocol for cancer, for inflammation, for seizure activity. He's on a pretty high dose. There's different dose recommendations depending on what's going on with your pet. It's also very important that you're using a high quality product whenever you're using CBD. Anyone can make CBD, and the cannabis plant will actually, it is a heavy metal attractor. And if it's not organic, it will be sprayed with herbicides, so like Roundup. So then you're putting all those chemicals and heavy metals into your pets. So it's very important that you're sourcing good quality CBD. I love, if you're in the States, Vet CS. We used it. I've used them for probably 6 years now. I think since they first started, I've used them. I love them, and they have great customer service, great quality product. You can call them and talk to them, but they're fantastic. Highly recommend Vet CS. They have a dog and a cat version. They have treats. They have a peanut butter like paste that you can use too with the CBD in it. And they have a human line too. So remember, we're part of the stress potentially. So if we need to rebalance ourselves, obviously talk to your human physician, talk to your veterinarian if your pets are on medications or something else is going on. And Debbie, yes, I can post a link. So vet CS, so like cannabis. I don't know what CS stands for actually. But vet CS, and you can always use code T as in like Todd 101 for a 10% discount too. But like I said, I use them for my patients, my own pets, help Finn tremendously. I love them. So definitely recommend them. Okay, so let me pop that into the chat for everyone really quick. And so Vet CS, and then for CBD, and then so code T101. All right, so that's for everyone. Just posted that down there. It's not a link, but you can type in Vet CS. It'll take you directly to them. And let's see. Okay, let's take a few more. So we're taking our 1-year-old dogs for their wellness exams tomorrow. What tests do you recommend on an annual basis? So this will depend on life stage too. But ideally, this is where do as much as you can, because it gives you a baseline for a healthy pet. So if things start tracking and trending in a direction we don't want them to go, so specifically kidney, liver values, red blood cell count, you'll be able to pick up a problem before your pet even knows it's a problem, before you start seeing symptoms. Very powerful, a lot easier to reverse. So your full blood panel, so CBC, so your red blood cell, white blood cell counts, your biochemistry profile. So make sure it's a full biochemistry profile. I get ones all the time that are like testing 3 different things. And I'm like, what about the rest? What are the total proteins, liver values, kidney values, all those stuff? Very important. Make sure they're also doing a urinalysis and also checking thyroid. You can always start with just a T4, but sometimes, especially if your pets are having weird symptoms or you're having a hard time resolving a symptom, this is where doing a full thyroid panel can be very powerful. We talk a lot about this and how to optimize immune health, the different tests that we recommend, but that's a great starting place for you. And then how do I feel about feeding a raw diet to pregnant and lactating dogs? If it's like a truly balanced raw food diet, and it's not just like raw meat and just some bones, it can work really, really well. Get Feeding Dogs by Dr. Connor Brady. Such a good book. And I believe he talks about that. And he has recipes too. So you can always dive in, and he talks about puppies also and raw food diets, and such a good book. Such a good book. Every veterinarian needs to every dog owner needs to read that book. It's so good. And it's thick. It's like a textbook, but it will help you to talk to your veterinarian if they're not open to it too. So definitely check that out. So let me type it in here. Feeding Dogs by Dr. Connor Brady. Such a good book. So thanks, Debbie, for sharing that too. All right. Okay, love this question. It's a common question that comes up with raw food with respect to and raw food. So with respect to freeze-dried raw dog food, is there not a concern about bacteria? I've seen conventional vet reports which caution against raw food due to this possibility. Thanks, Doug. Doug, I love this question because it commonly comes up, and it's a lot of times so if you haven't seen me on social media, you can go to the Natural Pet Doctor. I post quite consistently every single day and share a lot of quotes, research, facts, things like that. And I find it fascinating is a lot of vets will like instill the fear of God into like a pet parent's heart about the bacteria. And kibble diets are actually, they've had more salmonella recalls than any raw food, freeze-dried raw food diet on the market. So like people like try eating kibble. I would never eat kibble. I'd rather eat the raw food diet and take a risk with that than eating kibble because of the rancid oils that are sprayed on it to make the dogs and the cats want to actually eat it. And then also the salmonella, like it's just not ideal. So Doug, get Dr. Connor Brady's book. You'll be like blown away, but all the research and how he debunks all of those myths, because that's a myth. And the FDA in the States comes down hard on raw food companies. They don't want them around. And so they're like inspecting them a lot more than the kibble diets. So definitely take a look at that book, because there's so many amazing studies that will debunk all of those myths that commonly come up, like parasites, bacteria, things like that. So definitely take a look at that. And there's a lot of great resources in the program too, when we go through the pet food industry and the different types of diets that are also a great dive into. Let's see. How do I feel about feeding raw to puppies who are weaning from mother's milk to food? If you're doing it right, it can work really well. You're already getting them onto a species appropriate diet. So if you're a first time like raw food like feeder, this would probably not be the time to experiment. So I do not recommend that, or you need to make sure you're working with someone that knows how to make sure that you are feeding the right diets for pregnant, lactating, weaning puppies, especially large breed puppies during the growth phase. Very, very important. So let's see. What do you recommend to filter water? So go to the environmental working group. Kathleen, this is a great question. We use a Berkey filter, but the environmental working group actually has an entire breakdown of the different types of filters that are out there that you can purchase. And it has the pros and the cons. It's a great resource. So definitely go check out the ewg.org group. My pup has anal gland issues. I've upped her fiber, but still have to get expressed every month. There's an issue. So Kathy, this is a great question, common problem. This is where there's definitely something going on with like a root imbalance, and you did the right thing, like trying to see if increasing fiber will naturally express those anal glands. But when we think about anal glands, where do they sit? They sit right at the like base, like 10 and 4 of the rectal area, right where the poop comes out of the rectal area. And if you think about it, if there's any degree of inflammation, these holes where the anal gland expression, like the juice is being expressed, then what happens is the little openings get inflamed and they can close off, and that can build up like the sludge. It can be harder for it to naturally express, but typically it comes down to there's potentially like a food sensitivity, there's dysbiosis, a microbiome issue, that there's something going on neurologically too. So sometimes chiropractic treatments can help because there's nerves that run down from the spine to that area too and innervate those anal glands. So chiropractic adjustments can help align that and fix subluxations. Acupuncture can also help getting the energy flowing. So those are definitely something where there's a lot of different things that could be occurring. So definitely check that out. All right. And also I see someone having trouble scheduling with Calendly. I don't know how full it is. I know there are a lot of people on here. So if you're having trouble, like if it's saying that there's no further time slots, just send an email to info@thenaturalpetdoctor.com. And then what we can always do is I can open up more times further down the road. So if you are having trouble, you want to book a call and see, like schedule a call to learn more about the program, just send an email and we can go from there and we can help you out. Oh, I see. Got it. Awesome. Mary, I'm excited to talk to you on Friday. So, okay, Morris, what do you recommend for a 15-year-old Chihuahua with heart murmur? So there's a lot of factors. Like this is where when I look at patients, I'm always asking, like, we're not just focusing on one thing. I always want to look at everything. So this is why I teach like the 5 pillars, right? So the heart condition, heart murmur is one thing. So we know that the heart is not working as well. So we'd be looking at diet. So I'd be looking at, okay, what types of foods are we feeding? Are we on a processed food diet? Are we getting CoQ10, L-carnitine? Are we getting enough taurine? What supplements can we add in? Can we use organs? So heart, using organotherapy principles to help support heart health. Are we making sure we're putting in enough omega-3 essential fatty acids, which are really good for heart health? So I'd be looking at all of those from like a nutritional perspective and vitamins and minerals. Those can make a huge difference. And there's a lot of great supplements that combine a lot of those together, and then supplementing with organs, but making sure that we're feeding an optimal diet too. So if you can get over to a fresh food diet will make a huge difference. And then working with someone, I use a lot of Chinese herbs. It will depend on the pet and where those imbalances are, but we're typically looking at, how to blood tonics, and if there's stagnation in the body with the energy not flowing through those meridians. But that's where you can use food therapy principles too. And, giving heart will definitely help. So freeze-dried heart is a great option. Okay. I'm going to take a couple more. I'm not even sure what time it is. Okay, we've almost been going for 2 hours. You guys are awesome. I love it. Let's see. Okay. I like this. Okay, so Michelle, I've been trying to switch my dog to a home cooked diet, but he starts to get diarrhea. He also has gas. What would you recommend to help with the transition? So Michelle, if you can, do an animal biome test, see what the status of the gut health is. And this is where we have to keep in mind. So if you're going from kibble to raw, some pets, like I tend to go, I know my good colleague, Dr. Nick Thompson, he tends to do like a fast transition, like a switch. Like one day you're on this, you maybe fast them for the day, and then the next day they're on the new diet. I tend to be a little bit slower with my transitions just because I know a lot of pets will tend to get GI upset. And so what I tend to do when we think about diets, if you're switching from a kibble diet, high carb, and that's going to feed different types of bacteria in the gut health. So if you're transitioning to like a raw fed or even a lightly cooked that has higher protein, less carbohydrates, those foods are going to feed different types of bacteria. So if we have dysbiosis or an overgrowth of bad bacteria in the gut, that's when we can see GI upset. We can see excessive gas. One of the things you can do if you're like, I can't do an animal biome test, how can I help? Do a slower transition. So I typically say like quarter new, 3/4 old, transition over like 3 to 5 days. Using digestive enzymes can tremendously help to break down the food, help your pets digest it better. Go slower. You can sometimes use probiotics. You might want to, you have to be a little bit careful though when you have excessive gas already, because a lot of probiotics can upset the balance, and a lot of probiotics have prebiotics which feed bacteria, so whether it's good or bad bacteria in the gut. But you can also use things like slippery elm or marshmallow, which are going to soothe and calm down inflammation. So those would be definitely digestive enzymes. There's a lot of great pet brands out there that you can get in pet stores that you could use. Optigest is one that's commonly found. That's a good quality one. But try that, do slower transition. And then if that's not working, then definitely doing some of these additional diagnostics. This is a good question. Okay, so my golden doodle puppies are not on a raw diet yet, nor any supplements. They are fed blue buffalo, and I do add chicken broth. I'm not sure where to start. Would this be a good program for them? 1,000% yes. So this gives you the framework on where to start, literally the modules. So there's 5 modules covering those 5 steps we talked about. I call them the 5 pillars. And it literally breaks it down, like what's in this module, breaks down the science, physiology, why it's important, things you need to know, diagnostics, and it finishes with where to start. So my goal is to make it as easy as possible for pet parents to dive into the content, start implementing it. There is some technical things that we talk about with some of the physiology so you can understand it and go a little bit deeper, but that's where the power of the community and the weekly 2-hour Q&As are really, really helpful. So if you're going through something, you're like, I don't understand this. Like, how does this apply to my pet? You can pop a question in the community, or you can send that question over for the Q&A for me to answer it live. Either way, you're going to get a response from me. So that's definitely like the program 100%. And puppies, like, oh my gosh, puppies, they're right at the beginning of their life, puppies and kittens. So if we can do all the things to optimize their health, get them through, right? That's where we see 30-year-old cats, dogs getting into their 20s. That is always the goal. Less vet visits. Like you're just having to go in for like the routine wellness checkups and the routine blood work. And you're like, yep, still doing great. Let's just tweak and adjust a little bit because we know they're getting a little bit older. Tweak and adjust based on what happens. That's the power of this. And it's a lifetime program too. And it's not one pet, like one pet, one program. You can ask questions on any of your fur family. So last night we had one of the moms listening in with her daughter, and I loved it. And she asked a question. It was just fantastic. I was like, this is so great. Like the entire family is getting involved in the care of the pets, and like they're super interested in like the holistic path forward. I just love that. All right. Let's see. Let's answer a couple more. And you also get the recording. So once this is done, it is being recorded. So I'll also send that out in the email too that you registered with. Okay, I'm seeing a lot of good diets. So Lily, have a Cocker Spaniel. When he slept at night, he was drooling. That comes out in black stain on his pillow in the morning. I feed a home cooked diet from Dr. Judy Morgan. Also give Dr. Tobias supplements. So your thoughts. So I'd be looking at what's going on in the mouth. That's not normal, like a black stain. So I'd be thinking, is there dental disease? Is there like a mass somewhere too that's causing inflammation and that black staining? So you definitely want to get, if you haven't already, Lily, get your dog checked out by a vet, have them do a really good thorough oral exam, make sure we're not missing something, because that's not normal color saliva. Okay, let's see. You guys are on fire. Lots of questions. I love it. Okay. Okay. So animal biome, there's only one animal biome test. So if you type in animal biome, it's the only one that's out there. Okay. And I love this, like Tina. So Tina mentioned we've been giving turkey tail mushroom powder for 6 weeks, had an oral papilloma that's now gone. So this is where those supplements, like what certain things can we use to support immune health? And we know medicinal mushrooms, we talk a lot about, I love medicinal mushrooms. Those are really, really powerful at helping them. So I love that. I love that story. So thank you for sharing, Tina. And this is another great question. Our 1-year-old dog was allergy tested, found to have allergies to several proteins, chicken, turkey, lamb, salmon. Can she be treated to overcome these allergies? I would love to know how they were testing, because typically I see this all the time with my patients. And what happens is there'll be like a blood test to do a food or an environmental allergy test. And they just add like the food panel, which is food allergies are very rare. Food sensitivities are much more common. They can change. And that's where we have to focus on healing leaky gut. So it depends on how that was diagnosed, because if it was diagnosed through a blood test, I would say I wouldn't listen to that. And the other thing too is with those situations, a lot of times doing a less processed food diet that's a single ingredient, so novel protein, right? So if we're seeing a common reaction to common proteins, this is where you can use like rabbit or duck. And there's a lot of great companies out there, especially like in the US, over in the UK, that you can buy products from to create these balanced diets and use a limited ingredient diet rather than using prescription foods that are really expensive, like that ingredient list that I showed you. So definitely check that out. But yeah, I think, okay, let me go to our chat. Sorry, there's two things going on. You guys have been, I love it, like responding to one another. And thing is too, so like, this is the thing, this is where I always go, in terms of when we see issues, when we see health problems, it's a sign there's an underlying problem. So I talk a lot about root causes, and the symptoms are just that. It's a sign that something's off. It's like a check engine light, right? And we can either ignore it. So like an ear infection, right? We like use ear wash. We need to treat it to keep our pets comfortable. But if we don't ask a better question, like why did that happen? That ear infection is probably going to come back, and it'll probably come back with itchy paws or a hot spot, and it's going to get worse every single time. And so this is why it's so important that we don't ignore the check engine light. We dive deep into working through like, what are these pillars and where is my pet potentially off? Or maybe you're like, I hit it all on the head. That's great. Now I know I'm on the right path. I have the support. And that's the power of doing something like this, and what I'm so passionate about, because it made a huge difference for my husband's holistic health journey when he was diagnosed with an autoimmune disease like 7 years ago. And then utilizing that with Finn, utilizing that with my patients, like my entire world has changed since starting using holistic medicine years ago, when essentially my husband was diagnosed and going down this path. And it's due to the questions we ask and being aware of where things are off. When we do that, the game changes. That's where we see optimal health. That's where our pets thrive. That's where we feel our best. And it's so amazing. And Kathy, so I've done allergy blood tests, saliva tests, hair tests. They were all different. For looking for a food sensitivity, you want to do your NutriScan saliva test. That's the best one. Vets will tell you it doesn't work. The studies that were done, that were released, were tainted by a vet dermatologist sending in sewer water to purposely screw up the results, and then posted those and said that this made no sense. And so that was debunked by Dr. Jean Dodds. And that was never told to the veterinary dermatologist. They refused to believe it. So there's all sorts of stuff against the holistic medicine side, which is crazy. Your hair tissue tests. Now there's different types of tests that will look at, like hair resonance tests. I don't use those as frequently. There are pet parents that do see results, and like they avoid certain things and they see improvement in their pets. So that is definitely something that you could potentially get help with. But typically, like for your food sensitivities, I'd be looking at NutriScan tests. And Laura Lee, will this program help with a cat who's recently been diagnosed with potential FPI? It's ironic you asked that, because we actually had an entire not an entire, but a Q&A discussion about the different treatment options for FIP. So this is the thing where I can't guarantee like we would fix something like that, but that's the power of this community, is that by looking at where things off, how can we support immune health, support gut health, which is so essential for immune health, and doing all that we can. And if things come up, like helping you through that too with the community and the Q&As, and then getting other, this is the power, like there's so, God, the knowledge in this group. You know, it's one of those things where I learn stuff too, which is great. additional resources, the power of the minds coming together, right? And so the hive theory. So there's definitely a lot of tools and help. And yes, we did talk about FIP and some of the experimental drugs that you can actually access to help your cats that are, and there was a journal article recently too, talking about these that helped tremendously. So it is very, very, very powerful. And the way it's set up too, this is something we're going through like the call. You'll get more information about like pricing structures, things like that. But there are workbooks and there's transcriptions. So I love reading. I love listening too, but I love reading, downloading, taking notes. And I made sure that there's PDFs you can download to listen along to, take notes on, and transcriptions for everything. So you can always print it off too, or just read through it if you're like, I just need to get through the stuff really quick. So I tried to make it as easy as possible for you to dive deep into this information and get as much out of it as you can. And also, like, if you want to get through it fast, you can too, because I know not everyone wants to spend hours and hours researching. That's the purpose of this. Let me provide the materials for you to get those foundations truly solid. All right, everyone. Okay, so definitely check your emails. You should have an email, double check that it went out, but you'll get an email with that link again that I showed you on the presentation. You'll get another email with the recording so you can re-listen to this, including the Q&A, so you can take a listen to it if there was a question or you wanted to re-listen to one of my answers from your amazing questions. And I just wanted to finish by saying, you are all amazing, and you are why I do what I do, because you show up, you take the time out of your day to learn more, to help your pets. And we are all on this crazy mission together to make sure our pets we have choices for treatment, and that we're doing everything possible. And I appreciate every one of you. You have no idea how much gratitude I have for every single one of you for being here and just going to the next step, whether it's the program or just getting as much information as possible through what we share on these, through social media, through blog posts, our YouTube channel. Regardless, your pets are so blessed to have you as their guardians. So thank you so much for being here. And I look forward to talking to a lot of you and hopefully having you as a part of our program community. All right, have a wonderful evening, everyone. I'm Dr. Katie. Take care. Bye.